So today, we're not just talking about fighting cancer. We're going to explore a revolution in care that asks a much bigger question. How do we make sure that every single survivor has a vibrant, healthy life long after that battle is won? So let me start by asking you this, because it really frames our whole conversation. For millions of cancer survivors, this isn't some hypothetical question. Nope. It's a very real trade-off that doctors are now, finally, working to eliminate. And believe me, it is completely changing the game. For the longest time, medicine really saw cancer and heart disease as two totally different enemies, fought on separate fronts. But here's the thing. We now get that so many of the same risk factors, I'm talking about things like smoking, obesity, even chronic inflammation, they actually fuel both of these conditions. And this shared biology, well, it creates this crucial link that doctors are now really starting to focus on. And that has given rise to this amazing new field called cardio-oncology. The best way to think of it is as the ultimate team-up, a bridge between heart specialists and cancer specialists. Their goal is actually simple, but it is so profound. Get a successful cancer outcome, but without causing lasting long-term damage to the heart. So what's the secret sauce that makes this all possible? Well, it's something called precision oncology. Now, instead of a one-size-fits-all kind of deal, this is all about personalized medicine. Doctors can actually analyze the unique DNA and proteins of a patient's tumor to find its specific weak spots, its biomarkers. It's kind of like finding the exact key to unlock a very, very specific door. All right, so to really appreciate just how big a deal this is, let's take a quick step back and look at the traditional way, the old way of managing heart health during cancer therapy. The old model was, at its core, reactive. Doctors would often have to wait for symptoms, like fatigue or shortness of breath, to show up before they'd even start looking at the heart. Monitoring was just these general heart scans for anyone on certain drugs, and the chemo doses were pretty much standardized for everyone. The big problem with this? Well, if the heart started to show signs of weakness, the only real option was to stop or change the cancer treatment, and that could mean delaying absolutely life-saving care. So yeah, the biggest issue with this whole standard approach was its massive blind spot. It just couldn't predict or explain why one person's heart might be way more vulnerable to a certain treatment than someone else's. And that brings us to the new way, a complete paradigm shift that is absolutely reshaping the future of what it means to be a cancer survivor. And wow, when you see it laid out side by side like this, you can really see the revolution we're talking about. We're moving from a reactive wait-and-see philosophy to a proactive one, predicting and preventing problems before they even start. Risk assessment isn't just based on age anymore. It's based on your unique genetics. And the goal has evolved from just treat the cancer first to protect the heart while we treat the cancer. That is huge. So how is this new era of precision care even possible? Let's take a look at the incredible tools that are making it all a reality. This image really nails the core idea. In the past, treatment was all about the cancer's location. Where is it? What stage is it? But today, we're asking a much, much smarter question. What is actually driving this cancer at a molecular level? This lets us understand the specific risks before the treatment even begins. Okay, so there are three key breakthroughs leading this charge. First up, we've got genomic profiling. This means doctors can literally look at your DNA to find these little genetic glitches that might make your heart muscle more sensitive to damage from certain drugs. Second, there are advanced biomarkers. These are proteins in your blood that basically act like early warning signals. A simple blood test can spot a tiny increase in these markers, signaling heart stress long before you'd ever feel a thing. And third, molecular imaging. Now, this is way beyond a standard scan. It lets specialists see changes happening at a cellular level inside the heart, giving them an incredibly early and detailed picture of its health. I absolutely love this analogy for biomarkers because it's perfect. They really are like a super sensitive smoke detector for your heart. They can catch that first, tiniest little whiff of trouble, these tiny signs of stress, weeks or even months before a normal heart scan would show that a fire has already started. And that early warning? That changes everything. But look, this isn't just about cool science. This whole new approach has a profound, real-world impact on a patient's quality of life after cancer. For patients, this means fewer interruptions to their cancer treatment because doctors can get ahead of heart issues and manage them proactively. It means hidden damage gets spotted and treated early, preventing permanent problems down the road. And ultimately, it ensures that life after cancer isn't just a new battle against heart disease. It lets survivors truly, and I mean truly, thrive. And hey, the results are already speaking for themselves. Early studies are showing that when patients get these personalized heart protection plans, their long-term survival rates and their overall quality of life are significantly higher. We're not just adding years to life anymore, we're adding life back into those years. Which really leaves us with this final thought. The future of cancer care is holistic. It's about making sure that a victory against cancer doesn't come at the cost of a healthy heart. It is a hopeful and a much more complete vision of what it means to survive. The real question is, are we ready to fully embrace it?